Happy Friday, Baylor College of Medicine. Another week has gone by in what seems like another year of our COVID experience. You'll notice one thing about me, I am now wearing my official bandana, so just in case I need to be socially isolated, I can do that. We're all doing our best as best we can. I know it's not the most beautiful fashion statement, but it's the best I can do. It's been a rough week for a lot of cities, and as you know, I came from New York. I mentioned that last week. I have a lot of friends in New York. My sister still lives in New York, and our hearts go out for everybody who is feeling like they are really embattled in this horrible fight against the virus. Our hearts go out to New York, New Jersey. Detroit is really battling hard. Chicago's beginning to come online with some real issues around capacity, and New Orleans as well. And so we're very lucky in that I think Houston jumped onto this a little bit sooner. If you look at how we're doing as a city and a community, we're doing pretty well. I would say I'm cautiously optimistic. We've been remaining in that 1% to 2% of infection rate, and if we can continue that, we certainly should be within capacity in terms of beds and ICU beds. There's still some issues about whether or not we will be okay with ventilators, but we're working hard to solve all of the issues around the supply chain. So I'm pretty optimistic about how the city's doing, but it's for sure we are going to have to be in sort of this lockdown mode through April. And my guess is, if we're lucky, we might begin to come out of it in terms of maybe in the middle of May or so. There's some silver lining to all this. It's kind of hard to believe, but in the last 5 years, our country has moved very quickly to be anti-fact, anti-science, maybe led most by the anti-vaccine movement. But no one's talking about that now. And in fact, for the first time in my career, really, people are reaching out to academic medical centers and really wanting us to step forward and do what we do best, which is address big issues, deal with the science, try and deal with cures, figure out how we can deal with this virus by expanding testing capacity, creating treatments and vaccines. So we are finally, I think, in a position to really lead the healthcare systems around the nation. And I can't tell you the number of people who have called me just to say, please help us. We're behind you. Anything we can do to help you. And part of that is our board of trustees has really stepped up as well. They've been trying to get us PPE. We've gotten masks and face shields and hand sanitizer, not to mention a huge amount of donations to really help us in our battle against this virus. So we are really grateful to everyone in our community who's stepping up. But most importantly, I am really grateful to you in this Baylor community. I can't tell you how proud I am of what you all are doing. The first thing is we very aggressively went into social distancing, and I got no complaints about it. Everybody contributed. People are working from home, doing their best. I know it's not easy. It's a lot of misery, but we are all doing it and working hard. The second thing is that our caregivers, the people in the front lines of providing care to the sick, are really stepping up. No one's complaining about the fact that they're putting their own lives at risk when they go to work. In fact, they are jumping to work and volunteering. And I can't tell you what pride that gives me to know that our faculty, our healthcare providers, our nurses, our students, everybody wants to help. So I just can't tell you how impressed I am with our community, and frankly the way the Houston community has also rallied around. If it weren't for the fact that Houstonians are taking social distancing seriously, we'd be in a lot bigger mess. So once again, a great week for the Baylor community, a great week for Houston. Keep doing what you're doing. It is the most important thing we can do. It takes all of our efforts, all of your efforts. I'm so thankful for everything you do for our institution. And remember, most of all, Baylor is calling everyone to care. This is a call to care. It's our community effort. We're going to do the best we can for our institution, for our Houston community, and for the nation. So thank you very much. Thank you.
Baylor College of Medicine, called to care.